So if someone gets told they need a root canal, what would the best option be? Just get that tooth removed?
Well, first they need to find a dentist that doesn't have a knee-jerk reflex toward root canals, because there's a lot of dentists out there that, well, they actually truly believe that doing the root canal eliminates infection, when all it does, as I mentioned before, is assure you that infection will be there. So they might see some gum infection that's not really infecting the tooth, but is causing a generalized tooth pain, and rather than really work on the gums, they just go ahead and do the root canal. So the first thing you need is to find a dentist that's going to make sure that you clearly have an infection inside the tooth, and that there's not going to be much likelihood that you're going to be able to ever heal that tooth again. And if in fact the infection is present, then you need to have the extraction. And then you need to have a dentist who is aware of how to properly clean out the bone, because a regular infected tooth and always a root canal treated tooth, if you're extracting either one, the root canal treated tooth has a lot of infection deep in the jawbone, and that has to be cleaned out completely, or you can't heal in good solid bone, and you end up with another infectious process, which is not as bad as a root canal statistically, but still pretty bad, called a cavitation. And the cavitation is basically just a pocket of wet gangrene inside the bone, okay? And what do you do to gangrene anywhere else in the body? You cut it out, okay? There's gangrene has no blood supply, so you can't treat it with antibiotics to clear it up. You gotta debride. I mean, that's a basic premise of surgery, is when you get an infection and there's any pus accumulated, the first thing you need to do is debulk and get rid of all the pus, so that what you're left with is tissue that can be vascularized, and that antibiotics and other good nutrients like vitamin C can get in there and do the job that they need to do.